Alright, so you guys, on this particular organisms, these are the guys that require special nutrients and environmental growth factors for isolation and identification. Particularly, you're going to see like higher CO2, okay? But Haemophilus in general, here's your characteristics, okay? So I would know this slide. So that would be a good multiple choice question right there, okay? And then it requires at the bottom the X and B factors. Does anybody know what that is? What I'm talking about?
X is heminin, or?
Yes. No, yes. X is heminin, or they call it like the unknown. And B is NAD, or vitamin. Okay? All right. The other thing with Haemophilus is 10% of people actually carry it in their upper respiratory tract, just as healthy people. Okay? All right. The influenza is a major pathogen within the species, particularly serotype B, okay? However, we have the vaccine, the HIB vaccine, okay? There's actually, serologically speaking, not biologically speaking, but serologically speaking, there's 6 distinct types of influenza, okay? So acute inflammation of the upper airways. I mean, everybody has been through this, I'm sure, with some type of influenza infection and can relate to the symptoms, right? The other thing is there's encapsulated strands and there's unencapsulated strands, okay? So that would be another good question. Exactly. And so not all the strands of influenza are encapsulated. Okay, you have both going on. And depending on if it's encapsulated or not, it's going to kind of determine what type of infection you get. Because some can be localized versus systemic. Okay? There's a little picture right there. Okay, virulence factors. So capsule, number 1, that would be the most significant probably. IgA, proteases. Adherence, so we have fimbriae and other structures for adherence, and of course you have the LPS, which will have like a paralyzing effect on basically the respiratory epithelium. Okay, so those are your virulence factors. Now type B. This is just basically giving you a little bit of background right there. The last little thing, the anti-PRP, that basically elicits an immune response. Okay, if you don't have the vaccine, type B would still be the leading cause of bacterial pneumonia and meningitis in particular, okay? But since the vaccine, we've helped a lot of people not to get this invasive disease, or systemic for that matter, okay? All right, and this is what I was talking about before. Invasive disease, you have septicemia and meningitis, it's usually encapsulated. Localized infection, this can be non-encapsulated. You can get conjunctivitis even, and infection with your sinuses as well. But this has all been sort of cleared up with the HIB vaccine. All right? Now, in terms of laboratory identification, you're going to be pleomorphic on chocolate agar. Oh, which reminds me, I'll show you guys after this lecture. I do have Haemophilus influenza plated on chocolate agar. If you guys would like to see that, or if some of you want to even stain it, you're welcome to do that. Okay? There's actually no growth on blood agar or MAC. Okay? And then they're going to have X and B as biochemicals in the media for that. You also have an alternative test for identification as well. Porphyrin test, I think that's how you pronounce it, is what it's called. Basically, it will show up as like fluorescence on a plate if it's positive for that. And then you have detection of the type B capsular antigen as well, can be used in identification. Okay? The other thing I wanted to mention too is sometimes you have a hard time staining this, and so you would get really faint pink. So a lot of times methylene blue is used, and that actually gives you a much better stain. And because I'm saying this, that might be important. Okay? All right. And the other thing, Haemophilus die rapidly in clinical specimens, so it's very important to get them going as soon as possible. That's what the X and B look like right there, okay? They have these strips that they put on the plate. All right, So the grouping, here's the rest of your group that's together. All right, these are the rest of your organisms that are in this group, okay? Remember, gram-negative bacilli, and they're going to have an increased need for CO2. In general, fastidious organisms, high CO2, they're going to grow slower, actually, and poorer growers than Haemophilus, which is kind of interesting, because Haemophilus is quite hard to grow in itself. A lot of them contribute to endocarditis, and most of them are just members of normal flora that's in the mouth, which is a problem because they can go into the bloodstream, okay? These guys are considered opportunistic, so usually they're going to require a compromised host, okay? Let's see, also members of this group, they're going to be both fermentative and non-fermentative, okay? So you have both. This is just the therapy for endocarditis, an example caused by the HAC organisms. I just wanted to show that, what it looked like. So let's talk about the first one, Agricobacter. This is actually termed foam-loving for some reason. It's in dental plaque and scrapings, and it's B-factor dependent, okay? This is going to form small coccobacillus. It's also catalase negative, all right? And for your rest of the sugars, like glucose, maltose, sucrose, lactose, it's all positive. All right, so this likes carbohydrates, but catalase is going to be negative. Am I good to go on? Are you guys good?
So love sugars, glucose.
Foam loving. Yeah,
Foam?
that's not really important, but I'm not going to ask that, but yeah.
You said love sugars, glucose, maltose.
You don't need to know all the sugars, I'm just saying it's like most carbohydrates, it's going to be positive, but catalase is negative, okay? But you might, with that one, it might be easier for you to remember it as foam loving instead of the actual name. I don't know. Let's just throw it in there. All right, Cardiobacterium hominis. So this one, again, pleomorphic, which most of them are pleomorphic, non-modal, gram-negative bacilli. So we find this in the nose, mouth, and throat, and also it can be in the gastrointestinal tract. And this one's most prevalent too in endocarditis again. And again, this one's catalase negative, and it's basically positive for the rest of the carbohydrates except for lactose. It's lactose negative, okay? But for the rest of them, it's positive, positive, positive. But that would be a way to differentiate between the previous one and this one would be the lactose, okay? All right, Antigenic. Normal biota of the mouth and bowel cavities, of all things. This one's interesting because it usually results from a trauma, and especially after somebody bites you or you're in a fight, you can get this type of infection from human bites specifically. The other thing it can be involved with is in poor dental hygiene and or oral surgery. Again, opportunistic pathogen. It's oxidase positive. This one's catalase negative, okay? And it's also lactose negative. So not too much difference there. Let's see. The other thing with this one too that's interesting is it smells, what they say is it smells like bleach when you actually get a whiff of it, okay? And in the growth of the auger, there's usually what's called pits in the auger. So it actually has like a depressed center when you grow it. So it looks like there's pits on the plate, okay? Legionella, squared ends when you look at the morphology for this one, and they tend to resist decolorization. Okay, so that could be a problem when you're trying to grow it. Let's see, oxidase positive, catalase negative. It ferments glucose without gas, and it's also colonization of the upper respiratory tract, especially the tonsils. You have two colony types for this one. You have spreading and corroding colony type, or you have smooth and convex beta hemolysis. Two colony types, okay? Spreading and corroding. It basically looks like the plate's corroding. Or you can have a type that's smooth and it has a convex beta hemolysis. All right? All right, on this one, this is basically just a recap of the first slide. This is slide number 1 summary, slide number 2 summary. I'm not gonna repeat these, okay? We just went over this stuff, all right? All right, Pasteurella, okay? Zoonotic disease, non-modal, facultative anaerobe. All species are susceptible to the following antibiotics, as you see. This is especially prevalent from feline bites. In terms of looking at this with staining, they do what's called bipolar staining, and basically it has like a safety pin appearance. And the poles of the cells are going to be more intensely stained when they do brand staining on this one. Okay, so they'll stick out a little bit more. Now within Pasteurella, this guy is one of the most pathogenic right here. Okay, and it's recovered species from human specimens right here. Also cultured from, look at that, 70 to 90% of cats. So not too difficult to isolate and identify. Can grow good on chocolate and BSA, but it doesn't grow on enteric media. So what kind of media would that be? Somebody give me an example. On enteric media. Or enteric. Yeah, HE, MAC, SS auger, that type of thing. Okay? The other thing I want to point out to you guys is that because it grows on VAP, all right, and it has bipolar staining, and the other thing that it also does not do is satylism. Remember Haemophilus did satylism? This would differentiate this from Haemophilus. So that's how they would kind of split the two together, all right? So growth on VAP, absence of satylism, and bipolar staining can differentiate Pasteurella from Haemophilus, all right? Know that one because that's a total multiple choice question. So I just wrote it. Okay. Clinical presentations. You got a lot of them here. I would highlight this slide as a possible, I don't know, short answer type deal where I ask you to give me maybe like 3 or 4 of these guys on a short answer. Okay. So you have a variety of infections on this. All right, Brucella, category D, okay, by the CDC, which is not good. Zoonotic disease again, and then you also have stages of this one that's acute, subacute, and chronic. Let's see. It's described by the disease course, like what it does, and its geographic location is usually how it will be described, okay? And people that are at risk are people that have exposure to animals or animal products, so they would have a higher risk of contracting this. It doesn't form spores, and it's unencapsulated, okay? For your ID, this one is slow growing. Again, it faintly stains, but it's Brucellosis, okay? Has good growth on enteric media, so macadamia B is not a bad choice for this guy. Oxidase and catalase positive, and it's also indole negative, all right? The thing that I would suggest to you guys when you're going through these slides is you don't really need to get so much caught up with oxidase, catalase positive, indole negative, you know, for each particular organism. Unless I say this looks like it would be a good thing for multiple choice, I kind of would just like read over it but not really hone in and memorize that stuff. Because you're kind of going to waste your time and your brain's going to explode. Seriously, because it's too much stuff. There's too many details to all of these things. It's like kind of look at the bigger picture, okay? Like on this one, I would think the better thing to be thinking of is that it has good growth on enteric media, okay, like the MAC and the E and B. That's what I would try to remember from this slide, okay? What? All right, look at the clinical spectrum of Brucella. You have a whole boatload of things again, and so I would basically use this again probably as a short answer. It could be the two of them combined, okay? I'd ask you just to give me a quick little table of both of them, all right? And it's continued over to here as well, okay? All right, moving on. variety of forms that this one can take on, but it's going to be influenced by the group that the bacteria actually gets in, okay? You have your most common clinical form, which basically all that means is that there's an ulcer that will form at the site of inoculation, and then it would be followed by enlargement of the regional lymph nodes, okay? That's basically clinically what would happen with this. Small, non-motile, non-spore, gram-negative bacilli, and strictly aerobic. The other thing about this that's not on the slide that I'd like you guys to know is that since it's fastidious, it needs special media, and the media is called Thayer-Martin agar, okay? So Thayer-Martin agar for Brucellosis. And that will be on the test, okay? The Thayer-Martin agar. All right, as if you didn't need more. Bartonella. All right, does anybody know like the street term for this one? Cat scratch disease. Okay. Let's see. Endocarditis. You can get fever and bacteremia. I'm more concerned with this one is about the specimen recovery. Okay. It's kind of just a picture there, but specimen recovery. Collection is imperative during the early clinical course. That's going to be preferred, okay? And then the third point there, I would definitely highlight as well, okay? The orange fluorescent stain after 8 days of incubation is recommended. So it kind of actually takes a while to diagnose if you're waiting 8 days for the incubation to happen, okay? That would be a problem with somebody that actually has it. With culture techniques, again, this is just a real pain. It's difficult to grow in culture. Amplification-based molecular methods is better, and they'll also do serological testing as well. Okay, so it doesn't go down to your traditional group. All right, Bordetella. All right, isolated from humans and animals. We're the only known host, though, of the Pertussis, which is also known as what? Whooping cough. Okay. The optimal growth for these guys, 35 to 37. They're not going to use any carbohydrates, and the other problem is they're going to be inactive on most of the biochemical tests. So this again is going to be a pain in the butt to identify, except that the symptoms that the person has is so obvious that it's pretty easy to identify whooping cough, if that makes sense. But in the lab, it's pretty hard to nail it down. All right. Let's see. Anything here of importance that you guys need to know? This is just background facts on Pertussis. You don't really need to know. Associate the vaccine with it, I would say. But besides that, these are just other details. Okay?
So we don't need to know.
Not really, no. The one that I do want you to know is the one that I was talking about today about being divided into 3 stages. This one is saying prodromal and paroxysmal and then convalescent stage, okay? So you can use either or. And then also there's a Pertussis toxin as well that makes it the virulence higher, okay? So the 3 stages, be familiar with that, okay? That's basically, isn't that just, okay, for identification. All right, culture media is going to be important on this one. So you have Fiji agar, and you also have Reagan low medium, okay, for Bordetella. So know that for sure. The other thing is to be familiar that it's going to be direct fluorescent antibody test or serological test that will be able to identify it. Okay? You guys good with that? Did you highlight that? Okay, that's your most important for that one. All right, Legionella. I'm not going to spend a lot of time on this. Marianne did a pretty good job on Legionella. Basically, you're going to have usually Legionnaire's disease or Pontiac fever. The big difference between the two, which I don't think she hit on, is that Pontiac fever, you're not going to have pulmonary involvement, okay? Whereas Legionnaire's disease, you will. Let's see, lab diagnosis. There's urine antigen detection and culture for Legionnaire's disease. Pontiac fever, you're unfortunately going to be limited to serology, okay? The other thing that's important is that saline or buffer should not be used in processing or transport. And then the specimens should be refrigerated after 2 hours, okay? That would be for Legionella, okay? Do you guys have questions on these guys at all? See, it is, I feel for you guys because it is a lot of information. Barriers to infection, this would be a good short answer. You know, like give me, I don't know, like 5 barriers to infection for upper respiratory or lower respiratory infections, okay? That one's not bad. So I'd probably use this. In fact, I'll mark it down so I don't forget, okay? You guys feel good about that? Exactly.
Know that
See, I'm not horrible here. At least I tried to tell you. All right, what's the role? Okay. Basically, they're just going to try to prevent invasion of the pathogenic organisms by basically like staying in their place and taking up the space. Okay. They're also trying to stimulate a protective immune response as well. Okay. Meaning they'll produce like natural antibodies. All right. I think you had a slide in there, but I X'd it out. I don't know if this is the one that's on Canvas, or you have my old one that's on Canvas. I'm not sure. Do you guys go right to this slide?
No.
So you can X out the slide before that. Okay. Host risk factors. Let's see. Immune status of the host, the age. So infants and elderly are going to be more susceptible, obviously, to upper and lower respiratory infections. And then infections that will be induced by airway obstruction. So people that have trach tubes or things like that, they're going to be susceptible to infection. Okay? The mechanical clearance is important, right? Because you're going to have to be able to get the pathogens out. If you're not having clearance, that's when the pathogens are going to start hanging around. Right? So you would definitely not have airway obstruction. Okay? Virulence factors. Most of them, it's just basically adherence, toxins, and evasion of host defenses. Okay? To just sum it up, that's basically the 3 that they're going to do. Evasion of host defenses, an example of that, would be like having a capsule and not being able to have phagocytosis happen. All right, body site infections. I would definitely take time on this slide and the following slide when I'm talking about body site infections. You might get hit with a question or 2 multiple choice on these. Like, what's the causative agent of, I don't know, I wouldn't say pertussis because that's too easy. I'd pick something on there and then have it as multiple choice, okay? And same thing for this one. All right? Not too bad, not too bad. This is like 5 slides. All right, emerging viral respiratory tract infections. Here's your big list here. I think you guys are basically familiar with everything except for HNTV. This would be prevalent in pediatrics, and it's similar to viral bronchitis, okay? And then adenovirus would be severe acute respiratory disease, adenovirus infections, okay? Bacoviruses, those affect children less than 5 years. It's just an upper respiratory infection, okay? And then of course you have acute pneumonia, which is actually subdivided into diagnostic categories. So you'd be basing that on clinical setting, the presentation of the disease, age and type of the host that's infected. I'm not going to ask you about that. I was just giving you some background about the acute pneumonia, all right? And then, of course, immunocompromised host can be any one of these things. But as an example, for endemic fungus or fungi, would be Cryptococcus neoformans, okay? This would frequently involve the CNS, and you see this a lot of times in HIV patients. Viruses, it could be pneumonia, bacteria, you can be talking about Neisseria meningitis, for the immunocompromised host. And then protozoan, you have plasmodia or sleeping sickness. Okay? So those would just be examples of immunocompromised hosts. Alrighty? Okay, guys. So be thinking when we're talking about this about your bugs that are up here. These are all part of Enterobacteriaceae. Okay? Yeah, think about your unknowns. So as a whole, okay, they're not going to produce oxidase or be positive for oxidase, and they're all actually going to ferment glucose. As a family, they'll all do that together, right? Now, when I say ferment glucose, don't get that mixed up. In a math plate, it's lactose, okay? So that's why some will turn positive, some will turn negative on a math plate, but they actually will ferment glucose, okay? The other thing that's actually pretty important too is that they're all going to be motile at body temperatures except for Klebsiella, Shigella, and Yersinia. That's a good multiple choice one right there. See, Mercer, I like the way you think. Okay? Colony morphology. So you can do a BAP, we've done that, and you can do chocolate. Klebsiella and Enterobacter, they would be kind of hard to differentiate on those. But MAC is going to be preferred. The other ones that you can use, you can run HEs on all of them. Obviously on HEs, the Salmonella will stick out more than the other ones will. And there's also another auger that we don't have in the lab that's called XLD auger. You can use that as well. Let's see, in terms of, let's say, Enterobacter and Klebsiella, one of the things that I think you guys are noticing is that they're very mucoid, at least the Klebsiella is, and it's very runny, okay? So think about that on your unknowns too. When you look at a plate and see that, chances are you're dealing with the Klebsiella. And it's usually pneumonia, not oxytocin, okay? All right, virulence and antigenic factors. So they can adhere, colonize, produce toxins, and invade tissues. And most of them are going to have the following antigens, O, H, and K. O is going to be heat stable, okay? H is going to be flagellar antigen for motility. And K would be capsular antigen. Now, the VI antigen, that's only talking specifically about Salmonella enterica, okay? So VI is associated with Salmonella enterica. The other antigens are associated basically with all of the rest of the Enterobacteriaceae.
What was K again?
K was just capsular antigen. Did you get H?
H is motility.
Yeah, motility. And then O is heat stable. Okay? Okay. Endotoxic shock. This again would be from the LPS. I think you guys are good with this, right? With the LPS. I don't really need to go over this again. Let's see. The thing I did want to mention though, when we're talking about these, is they're going to actually be divided into two categories. You're going to have opportunistic and primary pathogens. Okay? So when I start talking about this, you'll see my list of opportunistics. Antibiotic resistance. The ones that give the most problems are listed right there. The Enterobacter, Serratia, Klebsiella, okay? These are going to be the ones, a group of them that are going to have the most problems. So clinical significance, all of them are resident microbiota, except for, again, here we go, Salmonella, Shigella, and Yersinia, okay? The rest of them are going to reside in the GI tract. And again, as I just mentioned, they're going to be divided into either opportunistic or primary pathogens. Okay? All right, there's your list of opportunistic. Any of them surprise you at all, or did they look pretty reasonable to you? Are you like, what the heck on any of them, or no? All right, I guess not.
Yeah,
Don't worry about that one, because it's not on the test. Okay? I don't even get into that. So you can actually just cross it out if you want to. Okay? It's not even in the PowerPoint. Primary Salmonella, Shigella, Yersinia. So basically, what am I saying if I'm saying primary here? You're going to get an infection even in a healthy host. Okay? All All right, biochemicals, basis-wise, they're going to do the carbohydrate utilization, so talking basically about TSIs and what do they do with the TSIs. There's nitrate reduction, and then the cytochrome oxidase activity, which most of them are going to be negative, as I said before. Okay. All right, this slide is awful. I can't even read what the very first thing says. Is it? Yeah. Okay. This is basically just telling you commonly used compounds that it's going to be in the selective media. Okay, I'm not going to ask you about that. Yay. Okay. Let's see. This one, let's mark this one for short answer. Okay, where I'd ask you to give me like 5 examples of a test used to measure metabolic characteristics. Okay? And this would be good for your unknowns too. Alright, next 2 slides you can cross out. Cross this one out and cross that one out. And cross that one out. There's 3. Okay? We're doing good here, guys. We're doing good. This is a great lecture. This is good. Cutting it down. It's like my throat hurts. Okay, E. coli. Let's start with that guy. All right. So, wide variety of clinical syndromes. You guys know from before that this would be the #1 nosocomial UTI infection, right? Normally isolated from E. coli biota. Look at where it says most strains, okay? It's going to tell you the virulence factors right there, all right? So we have a wide variety of infections. This one, again, from lab, you're talking about MAC and EMV media, okay? Let's see, what other biochemical reactions? Urease, that's okay. With urease, really, where that comes into play is really with Proteus vulgaris or mirabilis being urease positive, okay? The other thing that they use a lot of times with E. coli would be citrate, and that's the green slanted tube. You guys haven't used that one yet, but they'll use that one to differentiate between Klebsiella and E. coli, okay? Because Klebsiella would end up being positive, and E. coli would be negative for that one, okay? This one you guys need to know, unfortunately. This is the different classes of E. coli gastrointestinal infections. Everything from traveler's diarrhea to pediatric diarrhea. And unfortunately, no, I won't be that mean. I'll actually give you the name and then the abbreviation. I just won't write up the abbreviation. You see what I'm saying? Like I won't just write EPEC is what. I'll actually give you the word before it too. Okay, but you have to know what each of them are. That will be a multiple choice question, for sure. Okay? All right. The other thing that happens with E. coli too is septicemia and meningitis among neonates. Okay? It accounts for 40% of cases of gram-negative meningitis, which is quite a lot. All right? All right. Klebsiella. Intestinal tract of humans. It's in the soil, water, and plants. You have opportunistic and nosocomial infections. Your 2 most common ones are going to be pneumonia and oxytoca. Okay? Now, how do these differentiate? Kleb pneumonia has indole positive, whereas oxytoca indole negative. Okay? So on the indole test, that would be the way that you would look at that. Okay? Which one of our biochemicals does the indole test?
SIM.
Wrong.
Oh,
SIM.
God. Both of those is one of those.
The SIMs, the SIM. How do we do it? Do you remember? After you stab it, what do you do to look at the indole production?
You have to
Just
have
get pink
Kovacs
on the top,
reagent.
Should be pink on the top, so Kovacs reagent, and if you get the pink circle, that would mean it's indole
You
positive.
have to incubate it, don't you?
Well, yeah,
Or something.
yeah. It's incubated, then you can do the indole test. They don't do it on the spot. Okay, for Kovacs. All right, Klebsiella common biochemical characteristics. see most of them are going to grow on Simon citrate. Not all of them, but most of them. None of them are going to produce hydrogen sulfide. So this would help differentiate between, let's say, Salmonella and Proteus, okay? Because they'll produce hydrogen sulfide. So the other thing that's interesting, look at this. A few of them will hydrolyze urea slowly. So one of the things is that you would see Proteus with urease, boom, it's going to turn pink right away. Klebsiella, it can be like a light pink, maybe not a fuchsia, and it might do it over like a 24 to 48 hour period, okay? So it depends on your incubation time when you look at that. Motility is going to be variable with Klebsiella as well, okay? Do you guys have any questions on this? Because this should help you too with your unknown, some of these slides, all right? So remember about the hydrogen sulfide, good differentiation between this and like Salmonella and Proteus. All right, Enterobacter. You have two main Enterobacters here. We're gonna spend most of our time on Orogenes, okay? It says that it resembles Klebsiella when it grows on a MAC plate. Maybe Oxytoca does, but to me, Enterobacter isn't as mucoid as Klebsiella pneumonia. This one also grows well on Simon citrate, so that's going to be a problem with this and Klebsiella, okay, in terms of differentiation. It's methyl red negative and BP positive. Serratia. Okay, this is very characteristic of Serratia, although ours doesn't seem to be doing this at all. Of course, it's supposed to have this really bright red pigment when you see Serratia. Okay, maybe if we played it on a TSA, this is what we'd be seeing. I don't know if it's because we're on chocolate and mac, but it's not open pink. All right. Opportunistic, and it's associated with nosocomial outbreaks, has the red pigment. Marcescens is the one that is actually most prevalent. It's going to ferment lactose slowly. So on the TSI, if we were to take it out, let's say tomorrow, and whoever had Serratia, it might still show as negative, okay? But if you were to take it out maybe in 48 hours, you'd have a different reaction, okay?
That's why I put it under as a lactose fermenter.
Is that why?
Yeah.
See, well, that makes sense.
Yeah.
Okay. Yeah, very slowly. And the other thing that it's positive for is something that's called ONPG. Basically what that is, it almost acts like an antibiotic. It's a disc that you put on the plate and then it will get a halo around the colonies if it's positive for ONPG, okay? And there's another one that you could do that's ONPG as well. That's a disc again, and you just put on this kind of liquid, and if it turns pink, it would be positive. So you have two different ways that you can do that. Okay, Proteus. Mirabilis and vulgaris. Difference between the two, vulgaris is going to produce indole, okay? It does not ferment lactose, it's a non-lactose fermenter. You guys saw that on the actual plate, okay? The other thing is, always when you read about this, it's going to say that it has swarming colonies. Well, we've never seen the swarming colonies in here, at least. And the other thing is that it's going to produce hydrogen sulfide, okay? And again, it's urease positive. So it's pretty positive pretty quickly. So bright fuchsia. Okay, Citrobacter. This is another slow urea hydrolyzation. This one ferments lactose. We don't have this one in the lab, actually. It's going to grow in Simon citrate, positive methyl red test, and the most prevalent would be Florindae. Okay? This would be associated with like UTIs, pneumonia, intra-abdominal abscesses. Okay? So those would be your opportunistics. And now you have your primary pathogens, starting with Salmonella. That's a really good picture of Salmonella right there, with the black, okay? That's very characteristic of Salmonella. So MAC, non-lactose fermenting colonies, okay? Negative for all those tests, indole, BP, and urease. Most of the strands are going to produce hydrogen sulfide, okay? You have a number of virulence factors. You have the O, H, and H antigens. Remember, at Enterica, you're going to have the VI antigen. okay? Clinical infections are going to go all over the place here. Acute gastroenteritis, you can have typhoid fever. With the Salmonella infection, one of the things to remember about that is you can actually be a carrier for a really long time. I think we've talked about that, haven't we? With typhoid Mary, that was getting everybody sick everywhere. So, very long time you can be a carrier of that. Okay, let's talk about Shigella. Okay, not a member of the normal GI. Okay, dysentery is associated with Shigella, so I'm talking about bloody diarrhea with Shigella. Very unpleasant. Non-modal, is not going to produce hydrogen sulfide. It's a slow lactose fermenter. Usually on a MAC, it's going to take like 48 hours. Okay. And it doesn't use urease at all either, all right? Flexneri and Sony are the most pathogenic out of that family, okay? Both are going to be highly communicable. And again, with disease, they're all over the place, from being asymptomatic to having severe forms of the disease, okay? The other thing I wanted to mention too, between the two of them, you use the ONPG test, and Sony would be positive. That's how you would tell the two apart if you couldn't any other way, all right? So positive for Sony. Okay, I love this picture. It's so disgusting. Yersinia. All right, so Yersinia pestis. Plague, yeah, bubonic or granular form. One of the big things here is bipolar staining. It has a safety pin appearance. And the thing that I would highlight on here is the growth that it likes it at 25 degrees Celsius. Okay, that would be exactly what I would highlight. And usually they'll use cold enrichment to actually get it to start growing. Okay, let's see. Lab diagnosis. You're going to have to use a transport media. Those would be your examples of transport media. So immediate transport of clinical samples. It's going to depend on the site of origin of where they got the sample. Okay. Microscopic examination is not helpful because usually it doesn't stain so fantastic. But you can use BAP, chocolate, and MAC to recover it. Okay. All right. You guys good with that? All right, the last little part right here is really important. You're going to have this when you go out into your internships, okay? How are you going to be screening stool cultures and that type of thing? It sounds fantastically interesting, but it's still stuff that you guys need to know. So, this guy, possible short answer question right here, okay? So, really, I want to know, what are you routinely screened for? And right there, they're going to be screening for Salmonella, Shigella, and Campylobacter when they're in the hospital. They're also going to have the patient's history, okay? What's the description of the specimen? And then, interestingly enough, most fecal pathogens are going to be non-lactose fermenters, okay? Gross specimen. The other thing is, in the lab, a lot of times their go-to things are going to be TSI slants, which you guys know that. And ironically, not so much MAC, but HE auger, okay? They'll use the HE auger a lot of times. All right, so identifying an isolate oxidase negative, they're going to ferment glucose, they're going to produce nitrate. And then there's your biochemical test that they're mostly going to use. And you guys are familiar with most of these up here, okay? But those would be your go-to biochemical tests.
What's the LIA?
LIA is lysine, iron, auger, or something like that. It basically is can be a broth, and it turns purple if it's positive, and I don't think that we have it here. I'm going to look, because if we do, I'll show you an example of what it looks like. But you know, it's not one of the popular ones that we use. You know, you get by without using that, but that's a go-to in the lab. Okay, and then bacterial species and infections. This is just basically a recap for you guys, okay? talking about what they do. I'm not going to sit here and read everything for you, but it gives you the bacteria and basically what's the infection that happens. Okay? It's important.